2 more days of testing when it comes to COVID-19 is expected here in Parliament in the days ahead. Tomorrow, Thursday, the team will be here to take samples, and as well on Friday. So far, 690 people have actually been tested, and we gather that 100 more are expected to take the test in the days ahead. We wait to see what the response will be and what the results will possibly be. From Parliament House in Accra, my name is Joseph Opokugaku.
Right, Dr. Michael Owusu, a virologist with KCTR, joins us via Zoom with his thoughts on calls for the suspension of parliamentary proceedings. Thank you very much, Dr. Owusu. But later on, we're asking you who are watching the bulletin right now if you would want to know the COVID-19 status of your MP. And that's a question I'd also like to put to you, Dr. Michael Owusu. I mean, you certainly have an MP, and so you would have a say on that. But let's start with a conversation that's ongoing in Parliament right now about calls for the suspension of parliamentary proceedings. What do you say, or what's your view on it? Should Parliament be suspended for the meantime?
Yeah, good evening, Israel, and good evening to all your viewers. I agree that it is very important that Parliament suspends all activities with immediate effect. This is because Parliament is an important environment or area where we have legislators that represent various constituencies, and this is people that we must all uphold and ensure that we protect and safeguard their lives as individuals. They're quite important for us in everything we do, and also understand that there are quite a number of vulnerable individuals in Parliament, people who are more than 60 years, some 70, 80 years. And I'm sure that there could be some who may have some underlying conditions which are major risk factors for the disease. Although we know that largely many people are asymptomatic, we should not always forget that we have elderly people among us. And once you have these people contract this virus, the repercussions is going to be very serious. And it's very good that immediately they close this to allow for efficient contact tracing. And also the 2 weeks period for me will allow for those who are incubating the virus to at least show some signs and symptoms so they can be isolated. Because many are asymptomatics, it's possible that if they operate, others will join in and it's likely to spread. And we should not allow that our parliamentarians become heavily infected and then put those who are elderly in a serious condition. We don't have to allow that. And I think that the earlier we do this, the better for all of us.
But there could also be the argument that Parliament is doing exactly the screening that's happening right now because it wants to find out the ones who are COVID-19 positive, so they could be taken out from Parliament so parliamentary business can continue.
Yeah, so the way to tackle this kind of infection is that when you have a closed environment, and you identify people, if it's, I don't know how many numbers they screen, if you have 2 MPs or you have 13 other staff contracting the virus, it tells you that if you are to expand this to the larger population, there will be more who will be positive. And then this is why when you identify 1 or 2 cases, immediately you have to close the facility and disinfect the place and do contact tracing. Because if you don't do this and you only isolate those who are positive, it is possible those who are susceptible will keep getting it. And don't forget that this virus has a reproductive number of about 2 to 3. It is highly, highly infectious. So you cannot play around with such a close environment and only say that you want to isolate. If it's an open environment, you can do this. But then in such a close environment where people move in and move out, where you have vulnerable populations, it is better to put in measures quickly, close the place, do adequate contact tracing, disinfect all the area, ensure that good measures are put in place, and then before you can reopen. And during this period, you can allow for people to use virtual mediums for communicating so they can still go about their business. I am worried that because of the number of vulnerable populations within this group, it is important we protect their life. If they were young people, I wouldn't worry. I will say that, yes, let's go on. But then because we have some elderly populations within this group, we have to ensure that we do everything we can so that we don't put their lives at risk.
Now, considering the arguments that you have raised for reasons why you're saying that we would have to suspend parliamentary proceedings, the Electoral Commission is saying that it is putting in place protocols to allow it to start registration, mass registration exercise for the new voters register. Would you then say, by extension, that this registration exercise should also be called off? We'll be coming to the story a little later, but I just want to pick your thoughts on that.
Well, I don't think it should be called off. We have come very far. We started with a total lockdown. We have opened up markets and have allowed certain activities to go on and practice social distancing on the market. This has given us a certain picture, a view that if marketplaces are able to adhere to these social distancing measures and put on the mask and observe all the precautions, I mean, things will be fine, although we have had some challenges. So far, so good for us. So it is not out of place to put on a second layer where you can have us undergo such a vital exercise as voter registration, which is very good for us as a nation, and even to prepare us for the upcoming elections. There are about 22 African countries which are still going through this process. And then we know recently that a country like Benin even has gone through elections, but they have placed a cap on the number of people who are supposed to gather. So I have heard the conversation, and I've also heard the precautionary measures which are put in place. The fact that they are going to have a mobile health team available at every spot or registration site. The fact that they will have thermometer guns to screen those who come in, those who have high temperatures will quickly be moved and their samples will be collected and tested. The fact that nose masks will be made mandatory. The fact that Veronica buckets will be placed at vantage points. And the fact that they are going to mark areas and ensure that people are not crowded and also limit the number of people who come there. I think these are things that if we implement, it will not be different from what we are doing on the market because it's an open area where people cannot go their exercise. Right. What I've not heard from them is the elderly population. So I think that because the elderly are most at risk, if it's possible, they should allow the elderly populations to first undergo their exercise. And then when they are done, we can add on the young population. The elderly and perhaps those who are physically challenged, we should give them some priority because they could be more vulnerable. And the others who are 18 years and above, I think that they can adhere to these precautions and go through this exercise.
All right, thank you very much, Dr. Michael Usu. But then the question I was asking you earlier, would you want to know the COVID-19 status of your MP?
I wouldn't want to know. I wouldn't want to know because I respect the ethics of the medical profession and the fact that we need to protect every patient has a right. So if I go to do HIV test, I wouldn't want somebody to display my results all over that I'm HIV. We must understand that the SARS coronavirus 2 is like any other virus that we have had over the years, like flu. The only difference is that this one could be some more pathogenic. It's not like Ebola, which can strike you dead, within a couple of minutes or a couple of seconds when you get it. And it's not chronic. It's not going to live with you for the rest of your life. Once you recover, it means you have recovered. So I don't think this is the time for us to show faces or mention names. When they voluntarily come out to declare their status, it is all fine. But for me, I don't think that is necessary. What we should focus on is ensuring that the precautionary measures are well adhered in every constituency and to ensure that every MP implement the measures so that the populations can be protected and then we can reduce the deaths within our communities and with the whole of Ghana.
All right. All right. Thank you very much, Dr. Michael Usu. Dr. Michael Usu is a virologist with KCCR. And we put this question up on Facebook. We're asking you if you want to know the COVID-19 status of your MPs. And we have a few comments that we'll be sharing a lot more with you. Kwesi Boateng says, disclosing your medical status can be compulsory. What the MPs should be fighting for is the interests of the nation. And Issa Hussein says, all your battles will come to your evil people with evil minds. What exactly he means, I don't understand. But all right, so we'll be bringing you a lot more of the comments, but Aisha has...